evening, esteemed speakers and guests. It is a pleasure to be among you this evening to present the finding of my thesis, which was based on suicide attempts by Guyanese that were admitted to the Georgetown Public Hospital Corporation from January 1, 2013 to December 31, 2015. Now, in 2012, Guyana was listed globally as the country with the highest suicide rate. And this was according to the first World Health Organization report on suicide prevention. As such, I thought it would be important to conduct research that would lead to alleviating this public health problem in Guyana. Additionally, the literature posits that risk factors that can be related to suicide attempts were psychotic disorders, depression, chronic illness, parent-adolescent conflict, and a lack of sleep. Further, this study was aimed at identifying the patterns occurring in patients who have attempted suicide and were admitted to the public hospital. The study was a descriptive study and used data from the period 2013 to 2015. Data was gathered from 200 patient charts, and this was approximately 37% of the 534 patients that were admitted for attempted suicide during that period. A data collection sheet was used, and the sheet covered demographics, other categories, including risk factors, common methods used, whether or not these patients that attempted suicide used drugs not prescribed by a doctor, and whether or not this was the patient's first suicide attempt. The results revealed that the most common risk factor for suicide attempt was disagreement with a family member. Other risk factors identified from the study included a prior psychiatric history, being unable to sleep, history of miscarriages, lack of family support, assault from in-laws, and anxiety disorders. A proposed solution for those who are feeling overwhelmed and do not wish to speak to a family member or friend would be to contact the Interagency Suicide Prevention Helpline of Guyana, as well as more social and medical support with greater public understanding of the issues and support for families is encouraged. Now, the most common methods used for patients of suicide attempts in this study was drug overdose, followed by consuming forming chemicals and consuming rat poison. The gender variability identified with males, consuming forming chemicals was the highest, while with females, drug overdose was highest. A proposed solution would be to reduce the means of accessing these methods to a suicide attempt. The demographic findings reveal that the age range with the highest suicide attempts were from 13 to 20 and from 21 to 28. The ethnicity with the highest suicide attempts were East Indians, followed by Africans, those of mixed ethnicity, and Amerindians. Also, it was found that the most common risk factor, which was disagreement with a family member, was highest among East Indians. The region with the highest rate of suicide attempts was Region 4. However, this may be because the survey site was in Region 4. In terms of marital status, suicide attempts was highest among those that were single, followed by those that are married, then those that are in common, lowest in divorce patients. The religion with the highest suicide attempts were Christians, followed by Hindus, and then Muslims. In concluding, suicide attempts were found to be influenced by several risk factors from across different categories, such as affective factors, life circumstances, evasion of overwhelming issues, physical discomfort, ideation, confusion, accidental, and mental health issues. It is disturbing that suicidal attempts were highest among the age ranges 13 to 20 and from 21 to 28. Intervention programs need to be developed and implemented immediately to reduce suicide attempts among Guyanese. This research is one of the first to comprehensively document why Guyana is seeing the number of suicides I hope it can help us understand the triggers and vulnerabilities which can help us to both predict and manage self-harming behaviors in Guyana. Thank you for allowing me the opportunity to be here and allowing me this evening to present my findings.